HCA Florida Westside Hospital Internal Medicine Department proudly presents a case report by Dr. Vladimir Urevaev and medical student Prathmika Chandramohan. Narrated by the author. To puff or not to puff? That is the question. A case of pneumomediastinum due to the Macklin effect. Pneumomediastinum refers to the abnormal presence of air in the mediastinal space, often resulting from alveolar rupture. It can lead to serious complications such as pneumothorax or tension pneumomediastinum, but is typically self-limiting. The Macklin effect occurs when a sudden increase in intrathoracic pressure causes alveolar rupture, allowing air to escape into the pulmonary interstitial tissues and track along the bronchovascular sheaths into the mediastinum. Common maneuvers used while smoking marijuana: Müller maneuver, inspiration against a closed airway, and Valsalva maneuver, expiration against a closed airway, can create the Macklin effect, leading to pneumomediastinum. We present a 20-year-old man who has no significant medical history and presented with sharp neck pain radiating retrosternally to the chest along with shortness of breath. The patient reported that the pain develops acutely after exercising and worsened with inspiration and swallowing. The patient had been smoking marijuana and tobacco since the age of 12. Initial diagnostic workup, including a chest CT, confirmed the diagnosis of pneumomediastinum with subcutaneous air in the neck and right chest wall. The urine drug screen was positive for cannabinoids. Given the patient's history, the Müller and or Valsalva maneuvers while smoking marijuana were the most probable cause of Macklin effect, which resulted in pneumomediastinum in this patient. The patient was managed conservatively with a pain control using ketorolac and acetaminophen and 100% oxygen to facilitate reabsorption of air. Cardiothoracic surgery was consulted and determined that no surgical intervention was necessary, as the pneumomediastinum was uncomplicated. A barium swallow ruled out esophageal rupture. The patient was advised to avoid activities that could exacerbate the condition, such as heavy lifting, scuba diving, and further marijuana or tobacco use for at least 8 weeks. His symptoms gradually improved over the course of hospitalization, and he was discharged with follow-up arranged to monitor for resolution and recurrence. While spontaneous pneumomediastinum is typically self-limiting and resolves with conservative management, close monitoring is crucial to detect any progression to more serious complications, such as pneumothorax or tension pneumomediastinum. In this case, the absence of these conditions allowed for a straightforward approach with pain management and 100% oxygen therapy, restricting activities that could exacerbate the condition, such as strenuous exercise, diving, and smoking during the recovery process, is essential to prevent recurrence. Spontaneous pneumomediastinum, often caused by the Macklin effect, is a condition that has an excellent prognosis if diagnosed early, proper management is initiated, and complications prevented. This case highlights the importance of recognizing high-risk activities such as smoking marijuana with inspiration and or expiration against a closed airway, which can trigger the condition. It underscores the need for patient education about the risks of tobacco and marijuana use, both of which can compromise lung health and hinder long-term pulmonary wellness. We are now confident that our audience can correctly answer the rhetorical question posed by this case report.